promotion. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Adrienne, over to you.
Good morning. Adrienne Sturt from Austin Public Health. Happy to be here with you all today. Message for this morning, get tested. It's allergy season. We're enjoying the outdoors, but we're also encountering those little sniffles and drips. And if you have that inclination that it might be something more, go ahead and get the test. It takes less than 15 minutes. It's free. There are locations throughout Austin and Travis County. So it's better to be safe than sorry. Isolate until you get that negative test. If you are not feeling your best and you've gone ahead, that intuition has got you tested, take the next step and really make sure that you separate yourself from your family and loved ones just in case. And lastly, we are at the end of the tunnel. We can see the light. We're expecting a surge in vaccinations, but until we get to that point, there are 3 things that you can do to keep you and your family safe. Mask, wash your hands, and continue to practice social distancing. Over to you, Dr. Escott.
Thank you. And, again, we have another holiday coming up. We have Easter. We have Passover, Holy Thursday, Good Friday, Holy Saturday, Easter Sunday, coming one right after the other. And, this is a time where we want to celebrate. We want to go to church in person. We want to be with family. We want to celebrate, these holy days. But we're at a time now where we have to be careful. I was hoping that we would be done with this by now, but we're not. And that means we have to stay the course. We have to maintain the protections and get through this holiday without costing people's lives. And that means, you need to evaluate your risk level. As we've been saying all along, if you're a high-risk individual or you live in a household with somebody who's at high risk for severe disease, you should stay home. You should do virtual church. If you're lower risk and you choose to go to church in person, follow those safety guidelines. Wear your mask. Make sure you're distanced from others. Make sure you're washing or using hand sanitizer often to avoid transmission. If we do these things together, then we can continue to drive down transmission in Travis County, and we can buy more time to get more people vaccinated. This is a critical point. We are seeing cases surge in the United States. We've seen hospitalizations, new cases increase around the United States. 31 states are experiencing an increase right now. And we can't be too pleased with the situation locally and the situation in Texas right now, because as we have learned in the past year, things can change very quickly. So if we maintain those protections, we can keep our numbers down, get more people vaccinated, and avoid that third surge here. And it's critical that we, in particular, protect the older and more vulnerable people in our families. And that means continuing those protections this Easter. With that, I'll pass it over to Cassie DeLeon.
Thank you, Dr. Escott. And just to give some updates on where we are as far as our vaccine operations, Austin Public Health has continued to expand and add new vaccine locations so that vaccine clinics are available most days of the week. And from the beginning of our operations back in January to date, we have vaccinated over 180,000 individuals just with Austin Public Health alone. So there are a lot of vaccine options happening, a lot of clinics that are occurring even outside of Austin Public Health, but we are pushing a lot of vaccine across the board. And so we want to encourage everyone when they have access to vaccine and vaccines available to them to get that vaccine, to make sure to take advantage of that opportunity and get the vaccine. We also want to encourage that if you are due your second dose, that you don't delay. Try to get back and get your appointment by the 28th day, and try not to wait until that 42nd day. Try to get your vaccine within that time period. And then if you are encountering anyone who's hesitant about getting the vaccine, isn't sure, and you've been vaccinated, Be that ambassador. Tell them about your experience and encourage them to get their vaccine. The sooner we all get vaccinated and we all can be protected, we can get back to a more normal scenario where we can see folks we haven't seen over the last year, engage in things that we'd like to do, such as going out to dinner and whatnot. But this is not the time to get lax. It's very important that we continue all of these protection control measures. We continue to really buckle down over this holiday weekend. It's really important to only gather with those who are within your household and with those that are fully vaccinated to ensure that you don't open yourself up for additional infection or potential add more spread to the rest of the community. With that, I'll open us up for more questions.
Thank you. Now over to our pool reporter, Sangeeta Menon from KUT.
The first question is from KUT. Dr. Escott, you touched on this, but what advice do you have for people gathering for Easter services this weekend?
Again, I think we have to remember that COVID is still here, and that we still have to follow those protections that we've been following for the past year. There's a lot of temptation. Things are settling down here locally. More people are vaccinated, and there's this growing sense of we're done with this, but we're not. We're concerned that this may catapult us into another surge if we are too relaxed with those protections this weekend. So again, people shouldn't gather in large groups, particularly without masks on. But if people choose to gather despite the recommendations, if they follow the same guidelines, the masking, the distancing, particularly when they're around older people who may be vulnerable, that'll help to mitigate some of that risk. I usually love to be in person in church Thursday, Friday, Saturday, Sunday of Holy Week. It's hard for me. It's hard for my family not to be there in person. But we're going to do virtual this year because it is important for us to continue to protect this community. And our hope is that people will continue to modify what is normal for them, particularly during these celebrations, so that we can continue that safe practice and hopefully drive down disease spread.
The next question is from CBS Austin. Pfizer says its vaccine is 100% effective in kids from 12 to 15 years old and is trying to get emergency authorization in the next few weeks. Do you think there will be a push for this before students start classes this fall? And what is the vaccination situation for elementary school students? Do you expect those clinical trials to progress as quickly?
So there's a little bit of difference in the way vaccine efficacy is determined in children. When we think about the Pfizer and Moderna trials from last year, they vaccinated a group and they had a placebo group, and then they waited until a certain number of individuals in either group developed the disease. And they unblinded it to determine how many in the vaccine group, how many in the placebo group to determine the efficacy. For children, what they're doing is they're vaccinating the children and then assessing the antibody levels to determine if the antibody levels, which have been shown in adults to be protective, are happening in children. That's where that efficacy comes from. So it is a endpoint which is quicker to obtain. You can assess that, at least 2 weeks after the vaccination is completed. So I expect that for younger children, that those vaccine trials will be quicker than they were for the initial trials. The Pfizer and Moderna both have arms of their trials investigating children younger than 12. So it is feasible that over the summer that those results may be available to allow for some utilization in children. The other thing with the children is the dosing may be different. So when you go from 16 to 12, they've kept the dosing regimen the same, but when you go younger, people are smaller, And the other question is, what dose do we need for younger children of all ages? So there's more work to be done, but I think these are promising results, particularly for our middle school and high school students. And for them, it gives us enough time to ramp up vaccination, to reach those groups, to make it much safer in the fall for the return to more regular in-person education.
And I would also like to layer in, as we are anticipating additional potential for vaccine to come online as those trials wrap up, and potentially we have COVID vaccine available for children. I also want to encourage that we know because of COVID and some of the lack of ability to get into doctor's offices for well checks for children, it's really important to make sure that children are up to date on all their vaccinations. So as you're looking ahead to get your child the COVID vaccine, please also make sure that they're up to date on their current vaccine, all other vaccines. It's really important that they have full protection for all of the other childhood vaccines that are available to them at this time.
The next question is from KXAN. When do you anticipate any adult will be able to schedule an appointment through Austin Public Health? Why is that already available in other areas of Texas?
Well, I'm happy to start that one. It's available in Travis County as well through many providers. Austin Public Health right now is focusing on the 1A, 1B, 1C group, our child care staff and our education staff. Basically, right now, we have more people in that waiting list than we have vaccines available. So when we see those numbers in those priority groups drop enough to allow for us to make it available for other adults, we will certainly do that. And, it's hard to say the timeline for that. We have people on our waiting list who are on other waiting lists for other vaccine providers. So once we reach that particular point, then we will introduce the vaccination for any adult. Until then, we encourage folks to look for other sources of vaccine. There are many out there now, and we expect that as the vaccine supply improves, which we expect it will in the coming weeks, there will be more vaccine available outside of APH.
And just to add in, we do encourage everyone to go ahead and register and set up your account with Austin Public Health, and continue to watch your account to see if and when you've become prioritized and when you've moved in the waiting list, so that you are able to snag that appointment as soon as it becomes available. Again, it's hard to really put a real timeline on that, so it may be sooner than we think. And so we encourage just folks to be vigilant and watch for that, but also look at all other providers, as Dr. Escott mentioned. And in the meantime, continue to practice those protections that you have been by masking and social distancing until you can get that full protection with the vaccine.
The next question is from KVUE. Does Austin Public Health anticipate larger weekly allocations of vaccines from the state in the near future?
We are currently receiving 12,000 doses per week for first doses, and then we receive 12,000 second doses to mirror our first dose allocations when those 4 weeks later, to make sure that those who are due their second dose receive those. At this time, we're not sure. We are ready to receive additional vaccine when the state is able to get additional vaccine as well. So we anticipate that as vaccine becomes available and they can push additional vaccine to the hub location within Austin Travis County, that we'll be ready to receive that. Something to note is that we're seeing additional providers adding into the allocations that we're seeing in Travis County, which is fantastic, because that means there are additional locations that may be more amenable to a broader range of populations that just aren't able to access the hub at this time. So there are a lot of different avenues that the state is utilizing to provide vaccine across the state. And so that's really an opportunity to encourage more vaccine, encourage more providers to be part of the vaccine rollout, and just kind of be looking at that as a patient, looking to what vaccine providers are actually out there and where vaccine is accessible.
I'll just add on to that. Early on when we have new vaccines, and this is true for other vaccines in the past, when there's a limited supply, it makes sense to vaccinate people through hubs, so that we can prioritize those who really need it the most and then work the way down the list. Ultimately, the goal is to get vaccine close enough to home or work where it's convenient for people to get it where they would normally get a flu shot. If we can achieve that goal, it helps us get through the mass number of people that still need to be vaccinated in this county. One of the concerns that we have is that when we look at graphically what the vaccination rollout is likely to look like, we see a big spike at the beginning, right? Lots of people want the vaccine, and we vaccinate lots of people very quickly. But then it starts to decline, and then we have a long tail getting to that herd immunity. If we introduce vaccine, there are more vaccines available at pharmacies, at grocery stores, standalone pharmacies, pharmacy chains, as well as doctors' offices. It allows us to cut that tail off, to achieve herd immunity quicker, because it is more available, it's more convenient, and that makes it easier for folks to get it as a part of their normal routine rather than scheduling at large sites. So we do anticipate that the federal government will increase allocations, that the state will increase allocations to providers outside of APH to help with that particular issue. But I think generally speaking, we're on a good timeline that the president set to have vaccine available for everybody who wants it, certainly by the end of May. Children will be another benchmark, probably sometime over the summer for that. But again, as we've said before, if vaccine is available to you and you get offered an appointment, please get it. That's the best thing we can do for ourselves, for our family, and for our community to move past COVID-19.
The next question is from KOOP Radio. May is Mental Health Awareness Month. As we approach having enough vaccines to inoculate all who want them, is APH mandated or prepared to face pandemic-related mental health issues?
I'll start off with this one. APH has a longstanding history or track record of partnering with community agencies to provide mental health services. This is something that we have been talking about with our partners, the effects of COVID, the isolation, paying special attention to seniors. And there's been a lot of conversation as of late of the effect of being isolated or being required to homeschool on our kids. And so we do have several contracts in place with providers. We have been talking about how we reimagine those services in the light of the pandemic and how we are really paying attention to emerging needs to have a strategy to address them. So the short answer is yes, we are prepared. Our partners are prepared, and we have the beginnings of a good plan in place to make sure we meet our community's needs.
I'll also just mention that, when we look at our mental health infrastructure in Texas, it leaves a lot to be desired. I think we do need to examine further investments at the state level, particularly in terms of mental health availability in the school system. It is not anywhere close to the recommended levels of school counselors in our school system. And for the many students who are struggling with this school year, it is a challenge, and it challenges the system based on limited availability. So, we've got work to do, and it's important for those who are struggling through COVID-19, and there are many, many people that they reach out. They reach out to a school counselor, to a teacher, to a friend, or to a mental health professional, and start the healing process.
The next question is from the Daily Texan. How are vaccinations going for the 16 to 30 population thus far? And are you concerned about another spike in cases due to people relaxing their safety protocols after mass vaccinations?
I'm certainly concerned about a spike. Again, we've been flat here locally in terms of cases, in terms of admissions to the hospital. Flat is certainly better than increasing, but it's not as good as decreasing. And that leaves us concerned because, again, we've seen this before. And when it turns to increasing, then the situation can change very, very quickly. We're not out of the woods by any stretch of the imagination yet. And that means that we have to continue those protections to avoid that surge. And it really does take all of us continuing those protections. We're still within the window to see increases based on spring break. We are, investigating potential clusters associated with spring break. And, certainly we have the same potential around Easter. We've seen increases following many other holidays over the past year. And, if we all work together to continue those protections, particularly over this holiday weekend, it will help us to decrease the risk of another surge.
The next question is from Univision. Is Austin Public Health discussing the possibility of a mass vaccination clinic without appointments in the near future?
No. So the challenge with a mass vaccination clinic without appointments is people end up in line, either standing or in their car for hours and hours and hours. What we prefer to do, and I think what many jurisdictions prefer to do is you pre-schedule those, the large clinics, so that we have people who, I tell you, my wife went through Austin Public Health to get her vaccine. She was in and out in 20 minutes because of that scheduling process, because not everybody's showing up at once. I think that is important because it decreases the inconvenience of getting a vaccine and ensures that large groups of people aren't gathered together, and it keeps things efficient for traffic flow. I do think at some stage we will have smaller clinics that will not require pre-registration, walk-up type of clinics. But now that we still have lots and lots of people on the waiting list for our large vaccination sites, we will continue that process. But also, and we've done some already, have some smaller sites that are closer to home for people. But we can expect more of that into April and May.
Thank you, Dr. Escott. And just to piggyback on what you said, it definitely will be a matter of waiting until we have more vaccines available in community. And part of our equity strategy to really focus on those populations that are having disparate outcomes to COVID and have more barriers to accessing the mass vaccination pods. There has been some discussion about those smaller clinics or those smaller place-based pods that allow folks to walk up and at the same time register into our system and get a vaccine. So yes, that is in our future.
The next question is from the Austin American Statesman. When does APH think Austin, Travis County will reach herd immunity? Are we on track to hit it by the summer?
I'm happy to take that one. Again, it's a little bit challenging to predict. I think we'll get to 50%, 60% relatively quickly. The question is, how long will it take to get from 60 to 85% or 70%? The herd immunity is not a fixed location. It is mobile based upon the transmission of disease. If we see another big surge in cases, we're going to have to vaccinate even more people to try to bring down that transmission level. So, again, it really takes all of us being engaged in that vaccination effort, reaching out to people actively to offer vaccine rather than just waiting on people to sign up. And it's going to take all of our community groups that we're working with, reaching out to their clients, to their friends, to their members, talking about vaccine, helping to provide facts associated with the vaccine rather than the social media conspiracy theories that we see from time to time. I think the more we can do that, the easier it will be for us to avoid that long tail of vaccination to get to that herd immunity. But again, I will also mention that we can only really reach herd immunity when we have vaccines available for children as well. So I think for adults, we certainly have the potential of reaching herd immunity in those subgroups early in the summer, but it's probably going to be late in the summer or early fall before we can reach true herd immunity with the vaccination of children.
The next question is from Fox 7. How much longer will Austin need to wear masks?
Well, that's the $1 million question. I think it's likely that masks are going to be around through the fall of next year. Now, as we determine transmission rates based upon our case numbers, our hospitalizations, masking may not look the same between now and the fall. It may be less restrictive. It may be for certain situations, certain environments, longer durations of time, or places where there's particular vulnerability, like schools that don't have as many people vaccinated. But I wouldn't rid ourselves of the masks yet. In addition to that, we've also seen how effective masks are at decreasing the transmission of influenza. So it may be that, as part of our normal recommendations for flu season, that we recommend that if flu season is bad or they're going to be around, you're going to be around loved ones who are more vulnerable for complications from flu, that you wear a mask. So don't get rid of your masks yet. But we do expect the situation to change over the summer, and we'll certainly update guidance based upon the situation.
The next question is from Community Impact. State vaccine distribution is expanding, but the allocation to Travis County providers has gone down significantly in the last 4 weeks. Is Travis County as a whole still receiving its fair share of doses?
Well, first, let me say that I'm not sure that that's true. Austin Public Health has been getting their 12,000 a week for first shots, 12,000 a week for the second shots, and certainly providers are also receiving shots. What we've seen this week is that some providers had extra shots because of the winter storm. So those providers are catching up a bit. For instance, Austin Public Health received 12,000 second shots for the individuals who received the 12,000 first shots the week of the winter storm. Well, obviously we didn't give 12,000 shots the week of the winter storm, so we had excess supply for a short period of time while we caught up. Other providers are facing that situation as well. So in some circumstances, those vaccines were then given to different providers within Travis County. But certainly the indication that we're seeing going forward is that vaccinations are going to continue to increase, and certainly into April and May increase dramatically. That doesn't necessarily mean Austin Public Health's allocation is going to increase dramatically, but the overall allocation to Travis County, either through DSHS, through the state, or directly through the federal government program with the pharmacies.
The next question is from KUT. Will APH plan vaccine distribution events targeting 12 to 15-year-olds if Pfizer's COVID-19 vaccine is authorized for use by the FDA? Will you consider doing that through schools?
So I first just want to mention at this point, we've not been a Pfizer provider, which I think obviously Austin Public Health could absorb any vaccine that were allocated. But to date, we are only the Moderna provider, which is only authorized for the 18 and older population. However, as the vaccine trials go on and Pfizer becomes the vaccine or one of the vaccines available for vaccinating school-age children, Austin Public Health would certainly leverage the partnerships that we currently have with our school partners, as well as other vaccine for children providers, so that we can ensure that there is capacity to rapidly deploy that vaccine in whatever capacity is appropriate for reaching that population.
The next question is from CBS Austin. The CDC said yesterday that new research confirms people who have been vaccinated are not spreading the virus. How should this affect behavior in those vaccinated?
Well, I'll take that one. Again, we want everybody to continue those protective actions, even if they've been fully vaccinated. I've been fully vaccinated. I still wear a mask everywhere that I go. Our public health officials, our clinical staff, everybody's still wearing a mask. It does appear that the vaccine is very effective at preventing the transmission to the individual who's been vaccinated, as well as preventing transmission to other people. But we're not at a place where we have enough people vaccinated to have too much confidence in those protections. Again, we've got about 14% of our adult population fully vaccinated at this stage, about a little over 30% right now in that 16 plus age group who've received at least one vaccine. So we've got a ways to go. So my advice at this stage is please be patient. Please continue to follow the guidance that we provide about masking and distancing. We're talking about a short period of time before we're going to see some revised guidance going out as far as how vaccinated individuals can operate potentially differently from others. From the public policy standpoint, it's very difficult if there's separate guidance for vaccinated versus unvaccinated. There certainly we have seen the concept of a vaccine passport, which I think is a very dangerous technique to allow people to have additional freedoms. The freedoms we're talking about are not having to wear a mask, not having to distance. I think we can all be patient enough to wait a month or two before we need to, move towards that direction of issuing separate guidance. Again, we have to understand that every one of us plays a critical role in the health of this community, and that having the patience to continue masking and distancing and washing your hands for a little bit longer will certainly help to drive down the disease and get more people vaccinated to put us in a better situation for summer. If you're talking, you're on mute.
I think she may be, Dr. Escott. I will continue to ask the questions. The next question is from KXAN. How strong is the demand for vaccines in the Austin area? Are the numbers staying about the same, fewer, or are more people trying to sign up?
So we are definitely seeing a daily increase in new registrants on our portal to register for a vaccine appointment. And that is encouraging, particularly encouraging as we know the eligibility criteria continues to expand. And we do want folks to continue to register. As was said earlier, as the timeline goes forward and more vaccines come into our local market, there will be more vaccine available both within Austin Public Health's vaccine clinics, but also across other vaccine clinics. So we really encourage folks to continue to seek that vaccine out. But to answer the question specifically, yes, we are continuing to see an increase in demand and an increase in new registrants in our system.
Okay, the next question is from KOOP Radio. He said he recently received a vaccination from Dale Diamond and was given an appointment immediately for the next 3 weeks. Is APH prepared to do the same?
Yeah, I'm really glad you're asking that. For second doses, it's really important that individuals track when they're due that second dose and pay attention to which vaccine they've received. Austin Public Health is providing the Moderna vaccine, and so your vaccine is due 28 days after you've received that. Note that at 28 days, you start counting the day after you've received your vaccine. We are advising folks when they receive their first dose that they should expect to receive an appointment and a reminder that they would need to return on that 28th day to that location, and they should be receiving an appointment. And so we encourage folks to check their accounts. In some cases, their email email box may be full. Or they don't receive the text message that they have received their appointment. So we encourage folks to check their accounts to see that their appointment is physically there. And if they're not able to verify that their appointment has been made, we encourage folks to call 311 if they have not received information about their 28th day vaccine appointment and they're at that 28th day, so that we can get them in and make sure that they are able to get the vaccine as quickly as possible.
The next question is from Univision. What is being done to make the vaccine more accessible for the Hispanic community?
So again, we partner quite a bit with key leaders and stakeholders across the community to make sure that information about our vaccine clinics and how to register for the clinics is known and available. We also work to make sure that there's no barriers to accessing vaccine. As Adrian mentioned before, we really try to make sure that folks are aware that there should be no reason why they feel limited in coming to the vaccine site. We don't require that they produce an ID, and those types of things I think are could be somewhat limiting for folks. So those are some pieces that we're actually working with. And then there are other ways that we're outreaching to make sure that there are no barriers to receiving vaccine, ensuring that information is provided in appropriate languages, that Spanish and any other language that is desired, that there's assistance for folks both in our outreach materials, but also on site at our vaccine locations. We have interpreters available. We also have staff that are all bilingual, and so that the patients can feel comfortable in that space and have a conversation about their needs and ensure that if they're choosing to take the vaccine, that they have all their questions answered and are able to have the knowledge that they need to carry back with them, and then also carry back and encourage their family members to get vaccinated.
Thanks, Cassie. And just to piggyback off of what you said, all of that and making sure that we're being responsive to our community. This is the first time that any of us have navigated through a pandemic, and that we have been very conscientious about taking feedback from the Latinx community about unintended barriers to our processes. And we have worked with them to make adjustments. And it's all of those things that Cassie talked about, making sure that we have translation services available, working to have small pods in communities that are where the residents are primarily Latinx or Hispanic, proactively working with our community partners to call folks who need help navigating our systems. So really making sure that, we are intentional in our efforts within the constraints of being a hub, of course. And I look forward to the day when there is more vaccine in our community. And then as a public health department, we can shift into our role of being that safety net provider and really digging down into those community-based strategies that will ensure that not only are we, putting a more intense effort on making sure the services are amenable and appropriate for our Latinx population, but also for our Asian Pacific Islander and our Black American population as well.
The next question is from the Austin American Statesman. How is APH managing the newly eligible folks who need first doses and are finding it hard to schedule an appointment? i.e., when can we expect another mass vaccination clinic at CODA or elsewhere?
I'm happy to start that one. Again, we have a mass vaccination clinic most days of the week through our APH sites. We're certainly pleased to have another site at CODA. Again, it's really, when we talk about younger people, the people who are 18 to 30 or to 50, it's going to take time. We've got to have patience when it comes to getting the vaccine, because we have to remember that there are many, many more people who want the vaccine than we have vaccine to give to. So that's why we're still prioritizing those individuals in the 1A, 1B, 1C group, our education staff, our child care staff. Once we have an indication that the line is shortened enough for us to open it to other individuals through Austin Public Health, we will do that. Until then, folks can look at other sites, other providers, including CVS, Walgreens, HEB, Sam's Club, Targets, or their local healthcare provider to determine if they have availability. The Texas Department of State Health Services and TDEM have a great interactive site so that folks can identify where there is vaccine and where there is not vaccine. So that's another good tool for people to utilize. There are links for each of those provider sites through the DSHS. So it provides instructions on sign up. So again, it's going to take time. It's going to take months for us to get through these, all adults, certainly into April and May, to be able to have enough to be able to offer to everybody. But I think once we get to May, we'll be in a situation that there'll be much more availability, and it'll be much easier for folks to get vaccinated the same day they decide that they want a vaccine.
The next question is from Fox 7. Is there a possibility of rolling back to stage 2 soon?
Well, we have projections, and the projections show that, as early as the middle of April, we may start the entry into stage 2. When I say start the entry, generally we want to see us inside the stage for a week or so before we transition the stage of risk to ensure that we don't bounce up within a short period of time of that transition point. So it's certainly possible by the third week in April that we could be in stage 2. But the projections are based upon if risk-taking stays the same. If people continue to wear their masks, as is continuing to be mandated in the city of Austin and Travis County, if they continue to distance, if they continue to wash their hands, avoid gatherings, if we continue that, then May's looking a lot better. And certainly it's a short trip from stage 2 to stage 1. And that's why it's important for us to continue. If we just stay the course, if we continue to isolate and, if we're not feeling well and get tested and do all those things, that it is feasible by summer, we could be in stage 1. But it does take all of us, and certainly we've seen it across our country, 31 states, things are moving in the wrong direction. So very quickly it can change, and very quickly we can go from flat or declining to increasing. And it's, again, we're at a vulnerable spot, and we need to keep those protections in place.
The last question is from Community Impact. You mentioned our numbers are flat. Are you still concerned about the effects of the statewide mask mandate being lifted, or have we mitigated that risk due to expanded vaccine supply and extended local orders?
I think we're still at significant risk for seeing an increase in cases and hospitalizations. When we look at the published data on when the impact happens from things like removal of mask mandates, those effects can be weeks later, 3 to 6 weeks later. As the disease transmits, initially you have the initial transmission, and then those people transmit it to others, and then those people transmit it to others. So it may take some time, may take 4, 6, 8 weeks to see the true impact of events like the ending of the mask mandate or the 100% opening of businesses, or events like spring break that we just went through. So I think it's too early to tell or to be too confident that we haven't seen a surge from those events. But, again, if we maintain those protections, then it will hopefully push us on the decline, into April and certainly into May.
Thank you, Dr. Escott. At this point, we will move into our closing remarks. Adrienne?
Yes, thank you. It's always a pleasure for me to be a part of these conversations live. A lot of thoughts as I listen to the questions and my colleagues answering. I used to do youth prevention, and one of the core tenets of those programs was delayed gratification. We would teach young people, if you just plan your steps, wait to do these things until these measures are in place, you'll achieve a greater outcome. And I really think that's what Dr. Escott is trying to, hit home this weekend. Christian girl myself, hate that I can't go to church on Resurrection Sunday, but I know that, the Bible says that the body is the temple, so I can rock out to Jesus all day long on Sunday, right? And wait until that time where I can rejoin my fellow congregants and worship in a way that we're used to. And just this virus is within our control. It's about behavior modification. And so I'll go back to some of the points I said at the top of the hour. If you feel like your allergies might be kicking, just kicking up stronger than you remember in past years, go get a test. It's free. It's everywhere. 15 minutes of your day for some peace of mind. And while you're waiting for those test results, or you're feeling like not yourself, just isolate, take some time to meditate, read a book that you've been, looking to read. There's some things you want to do, but if you just hold off the 48 hours, most test results are back in 48 hours. You can get those test results and you can have that assurance or peace of mind that you are okay. And then the last thing, that destiny, is people, we like to have control over our lives, and we definitely can't by masking, by washing your hands, and by social distancing. Thank you.
That's really hard to follow, but I'll say delayed gratification is what it's about. If we just protect ourselves now, we can protect our families and protect our community. It is a big holiday. It is a big family holiday that is coming up this weekend, but we have to remember that, there are people in our families, there are people in our faith communities that are very vulnerable to COVID-19. They're at high risk for severe disease, high risk for hospitalization, and high risk for death. If you don't want to do it for yourself, do it for them. Please, if you're going to church in person this weekend or this Holy Week, wear a mask, distance yourself from others, wash your hands frequently. It's the best thing we can do for our families, and it's the best thing that we can do for this community. My hope is that everybody stays safe out there. But as Adrian just said, the hospitalizations and deaths from COVID-19 that are happening now are on us. We have the ability to prevent. We know how to prevent this disease. We have a vaccine which is available. We have to be patient. We have to have that delayed gratification. And if we do that together, this summer is going to look a whole lot brighter. With that, I'll pass it over to Cassie DeLeon.
Thank you, Dr. Escott. And just to close out, yes, it's exciting that we have vaccine, and it's really exciting that we're seeing so many more people get vaccinated and the eligible population continue to spread and the interest in vaccine to continue to increase. With that being said, delayed gratification is the situation right now. My own personal experience with friends and family, I continue to hear even daily about individuals who had been so vigilant this entire year and contracted this disease, and unfortunately are having a rough time with it, have to go to the hospital. And there are still those accounts of people who are losing family members. It's really, really important. Although we're seeing as a population, those rates go down, but I don't want it to be my grandmother that suffers and dies. I don't want it to be my friend or my family member. I need everyone to protect themselves so that none of our families have to suffer another person having this disease or another family member being lost. So with that, we can do this. We can protect ourselves and protect each other. It's going to take some time still, but we have the tools. It is on us. We can make it happen. Thank you so much.
That concludes our media availability for today. Thanks to APH Assistant Director for Health Equity and Community Engagement, Adrian Stirrup, Dr. Mark Escott, and Cassandra DeLeon, APH Chief Administrative Officer for Disease Prevention and Health Promotion, and to our pool reporter, Sangita Menon from KUT. Thanks for joining us and have a safe day.
not born in this town. That old highway wore me down. Days roll by, turn years. I don't know why I'm still here. They told me he'd love me so, but there were things he'd never know. Then one day I said I'd stay, but he'd already told me.